The two areas that we've been hearing where AI is going to have this hugely transformative effect, one is healthcare,
Yes.
and the other is education. Both of which in a country like India again become critical, given the sheer size of our population, the fact that large numbers of people still are denied quality healthcare and education. Do you believe AI will be able to bridge those inequalities in a way that perhaps was not imaginable, again, pre-AI? Or is that a dream that's being sold?
It's a very ambitious dream. The good news is that it's actually being tackled and addressed. I'll give a few examples. So in the area of healthcare, one of the key issues in many parts of the world is the ability to do diagnosis of a whole range of things. So one of the breakthroughs that we had a few years ago is what's called diabetic retinopathy, where you're able to take a look at retinal scans and observe and diagnose a whole range of things, from cardiovascular conditions and a whole range of things, just from retinal scans. And we've already so far in India actually done retinal scans with diabetic retinopathy of something like over 600,000 patients. So the question is, how do we scale that? So we're working with partners in India to see, can we get to where we can diagnose millions of people using this technology? Tuberculosis is another. So it turns out that something like 40% of the people in the world who have TB go undiagnosed. And most of them live in the global south, in India, in Africa, and Asia, and other places. And so we're actually able to show that with AI, you can do very accurate TB diagnostics. In fact, we actually did some tests in India and in southern Africa to show that it worked. So those are just examples where all of a sudden you're able to bring real solutions to places that otherwise, either because of skills or capability gaps or infrastructure gaps, we've not been able to provide healthcare to those places. I think that's exciting, and I think that's the exciting potential, that what we can do with these scientific breakthroughs and apply them to areas like healthcare, I think is very, very exciting. Take even agriculture. One of the things we're doing, for example, I think we've partnered with Wadwani AI, and we're doing work in agriculture, where you can start to think about how do you use AI to actually build kind of new kinds of plant structures to be able to assist farmers. So being able to bring these kinds of solutions where they're needed the most, I think is one of the most exciting.
And that's scalable. All these models are eminently scalable because of the very nature of AI.
They're extraordinarily scalable. I mean, one of the things I love about, the partnership and collaboration work we're doing in India is you're able to actually deploy these things at scale. We worked last year with the Indian Ministry of Agriculture, where and with farmers, because we had just developed this breakthrough ways to predict monsoons. And we actually use our latest model, Neural GCM, to predict monsoons. Actually worked with the ministry along with University of Chicago. And we actually showed that we could actually get monsoon warnings to 38 million farmers in India. That was just the first trial. So now we're actually hoping to be able to do that in many more places.
And that kind of work will have a strong ground level impact, because climate change is impacted in the monsoon cycle of how it pans out. I wanted a quick follow up on the India bit, and the realization that Rajdeep and I have been having in multiple conversations is that while the United States and China lead on certain kinds of development within AI, seen as superpowers in some ways, a lot of the application work and the ability to make AI work at scale, that opportunity exists in India across sectors. Just as an example, in the healthcare space, one of the largest hospital chains just told us that it gives them the ability to reach high quality healthcare to rural India, which was not possible. You agree with that?
Oh, I fully agree. I think one of the things that we often forget is that, well, first of all, we're learning that, for example, when you give AI tools to health practitioners, whether it's nurses or doctors, or even care providers of various kinds, it dramatically enhances their ability to provide care. And when humans work with this technology, it makes a big difference. Now think about the massive expansion of capacity to deliver health when many more people are using these technologies in places. I think that's extraordinary. But I want to go back to something you said, which is, I think the application opportunity is enormous, but I also think that the ability to invest and actually innovate and drive some of the research and innovation is also exciting. I mean, that's the reason why, for example, in our case, You probably saw we made a big investment in India last year, a $15 billion investment, and that's focused on not only helping with the infrastructure and kind of a gigawatt scale data center, but also to be able to do investments in innovations and training and access so that actual research that encourages research to happen in India for the benefit of India and, in fact, quite frankly, the world. So I think both are real opportunities.